call myself holistically minded psychiatrist. I've been in the field of psychiatry since 1989, so that's 35 years in private practice, and prior to that, another 5 years of residency, fellowship. And when I started psychiatry, I was a conventional psychiatrist working in the hospital in busy private practice, consulting patients on inpatient psychiatric unit and outside. So I was very glad to be busy, to be a psychiatrist. I loved it. However, as I was working, what I noticed very fast that all my patients have been relapsing. One of the responsibility I was given is to take care of substance abusing patients, those who are abusing alcohol, all kind of drugs. And as I was treating them on inpatient psychiatric unit, they did well, but when they would leave the unit, they would relapse. So I began to think that something maybe I'm not doing right. I began looking for all kind of other methods. One of the methods that I learned about at that time was auricular or ear acupuncture, putting just 5 acupuncture needles in the ear. And it was a very simple but remarkable method, because people were able to get relaxed. And what was quickly noticed that the many people who would get out of the unit after they would receive this method, they were doing much better and they were not coming back to the inpatient unit. But then I learned that there are many more points on the body. So I went for training in acupuncture. That led me to understanding that there is many different other ways to treat people with emotional and substance abuse issues. So I began to get interested in that and learning many more methods. And out of that, I finally found out that the hospital is too restrictive because they want me to keep all patients on medications. So I moved out and started my private practice in Glen Head. It's on Long Island, where I am now. Basically, I very soon when I went to acupuncture school, one of the person there went to school of naturopathy, natural medicine. So naturally, I got very interested in that, and this person worked with me for about 10 years, and then a couple of other naturopathists took his place because he also moved on. And so for the last 25 years or so, I'm working in conjunction with naturopath, which actually helps me a lot and helps my patients. So the way my practice evolves and the way it's going now is that many people come to me who have been on different psychotropic medications or psychiatric medications, and they develop multiple side effects. Their lifestyle is kind of very restrictive, and so they want to get off. And I was lucky to get in touch with some ultra-Orthodox, some people from ultra-Orthodox community. So they began to refer patients to me. And so gradually I began to learn more about, ultra-Orthodox Jews, how they function. I myself am a Jew, of course, but I'm from Lithuania, so I know very little about religion. But kind of my family was very much affected by the Holocaust, so it's all very much in my blood. And as I was learning and I was on a very intense journey to learn some methods how to help people who want to get off medications in non-orthodox way, meaning not in a conventional way. So just to tell a little bit, psychiatry, conventional psychiatry, kind of went through a number of stages of its own development, and if it's in spite that it's considered to be quite advanced field, in many ways in medicine, it's very much behind most of other medical disciplines. And those of you who know about how, if you go to one psychiatrist, you may get a series of diagnoses. You go across the street to another psychiatrist and you may get completely different diagnosis. So psychiatry as a field is still unfortunately quite inaccurate and in quite a sort of a primitive stage of development. Meaning if most of other disciplines, when you go to a doctor so they can evaluate you by a medical test. In psychiatry, it's only kind of what you observe and what patient reports to you. And what you observe can different from every psychiatrist may have a different view, as well as we can have different opinions about the same human beings. The same thing, people who go to psychiatrists may present different symptoms. So the field is quite inaccurate. Another very interesting thing that happened in psychiatry in the 1950s as psychotropic medications or psychiatric medications began to come up. And pharmacological field kind of took over the field of many disciplines in medicine, including in psychiatry. And basically, most of the education that psychiatrists receive nowadays, and I was one of them, it's from pharmaceutical industries. So we all have been kind of corrupt by that field. It took me quite a few years to stop the process to get out of it. So what methods can be done for people who have been on many medications? So number one, when somebody comes to me, what I do, I start with taking a very careful evaluation of the history. And so initial interview, usually it's a minimal 90 minutes, and plus I ask people to complete quite extensive questionnaire so to find out what exactly has been going on in their life, what happened, why they needed to be put on medications. So that is a big question for every patient who comes to me. What happened? So, for example, one of the big issue is so-called PTSD, or post-traumatic stress disorder. It's basically when the people have been traumatized by some sort of thing that happened in their life. They're actually something that happened even beyond their life. Like in my family, let's say most of my father's family was killed in the Holocaust in just one afternoon. So that clearly affected him, even though he was able to escape. But it affected it affected us who were alive. And this trauma can be carried on. And there are very interesting ways to deal with that. one of the way called systemic family constellation work. And if it would be of interest, I can discuss it later on. Another thing that I learned is that we all are energetic beings. Kind of, we all have energy, and this energy kind of moves in us. So, and we can help this energy to move in a good, in a positive way by doing a number of things. For example, as I mentioned, acupuncture can work on that. Another very interesting tool I'm using now is called neural therapy. Neural therapy. It's a field that's not well known in English-speaking countries, but quite well known in German or Spanish-speaking or Russian-speaking countries. It comes by different names, but basically it's an injections of small amounts of local anesthetics like Novocaine or Procaine, something that you would get in the dentist office to numb yourself. But in order to resolve emotional illness, of course, it's not to numb it, but to help people to move this negative energy which they accumulate in their body, which kind of gets stuck in a particular places in their body. And people may feel it or may not. By finding where these places are, and it can be done by palpation or by muscle testing exam, and then giving small injections while people are thinking of a negative thing, so you can sort of help them to move this energy and to get it out of their body. So this is another method that I'm using nowadays quite often. There is also herbs and supplements. So when people want to get off medications, usually there are a number of obstacles to that. One of the biggest obstacles is people at times want things happen overnight. And unfortunately, things don't happen overnight. So you need to be sort of disciplined in many ways. Meaning that as people put on psychotropic medications and as they stay on these medications, so they develop their bodies and their mind, develop certain dependency on them. So in order to help them to get off, what is important is to start a reduction of these medications when people are ready, when people are stable, start reduction in a very, very, very slow way, at the same time helping them to get back to the life that they used to have, to the normal life. Let me give you a couple of examples. So about a year ago, it was probably close to 2 years ago, one of very nice ultra-Orthodox man, father of 5, he came from a different community, a different town, where he was quite respected, but he came to New York area to get married, and he had, I think by the time when he came, he had 5 or 6 children already, and he became involved. He was a very nice man. He became involved in trying to help people to resolve some of the emotional issues, and he learned it from somebody to do some dosing, and he got so involved in that, so he sort of became overwhelmed. And at one point he developed a psychotic episode where he sort of got all his children and told that he became a messiah. He was throwing all stuff from the window. Anyway, he had a significant nervous breakdown. His in-laws admitted him to the hospital, and he actually had 2 hospitalizations. And when he came to me, he was on medications for bipolar disorder and for psychosis for the last 3 years. He was a very, very nice man, and so I identified a number of issues that were with him. One of them that when he changed his community, he was not kind of accepted fully. He was not recognized for his talents, and that affected him significantly. So I helped him to deal with that. And as we were doing it, I was gradually reducing his medications. When he came, he was on about 3 medications. So, and usually my approach is to start gradually reducing 1 medications. Then when that one is done, start going to another one and another one. And basically he was able to respond very nicely. And then his wife had another child, and they decided, I got him off all medications. He was actually quite stable, and he decided to move back to his community where he came from. And I recently had a phone call with him, and he's doing quite well. He has been off medications for probably about close to a year, doing very well. One of the things that I taught him is to how to be careful about his life, because he's a very sensitive man. So, and he was very, very open with his heart, but he was also traumatized. So I taught him how to keep himself safe and how to help him to function in life well. Okay. Ronit, if you are there, maybe people have questions.
Hi, thank you so much. Thank you so much. Yes. Okay, let me just see something. I hope that it was recording.
Okay.
Okay, all right. So I just started recording again. Sorry about that. Okay, so anybody have any questions for Dr. Gurevich? He just spoke about what he does. He spoke about acupuncture, neural therapy, herbs and supplements. These are different things he uses for his patients, and he just told us a story just now about somebody who he helped take off of 3 medications, who was on medication. And so anybody have any questions for Dr. Gurevich? I'm going to mute.
So people are still mute, so if we can unmute them.
Actually, let me unmute them. Yeah, let me.
Right. So if they have questions, please.
I have a question.
Yes. Okay.
I know someone, and they're sort of related to me, that he's been on medications ever since he was 6 years old, and I'm very concerned about him. Can you hear me?
If you can speak in a little bit better now. Okay. Yes, I'm listening.
Okay, I'm listening. I know this person who's somewhat related to me. He's in his late 30s. When he was a young boy of 6 years old, his parents put him on antidepressants. I didn't know if they put him on Ritalin and stuff like that. Now he's married and they're expecting a baby. I'm kind of like, in a way, worried about like him handling his life with a new baby. He never really, doesn't have like, he's not connected with his own family. And I want to know, they live in Florida. I don't know how I can help him, but it makes me very worried about like how he's going to behave in that new kind of a situation, because he's, hasn't been exposed to children or babies. And I am familiar with people on those medications, could go either way.
Yeah. No, I hear you. Somebody who, so let me see if I got it correctly. It's somebody whom you know who have been on medication since age of 6, and now he's in his early 30s, and he's married, has a child, right? Am I right?
They're expecting a baby now, and I just wondering what kind of support that I can give them or the wife. I'm a little bit worried about his behavior before, during, and after the baby comes. Like, he already told his wife that it's okay for her to put the baby in the other room when the baby's 3 months old. And I said, no, we don't do that. So I'm just like a little bit worried about, he doesn't have experience in this, and I just want to make sure that the baby and the mom are in a good place. Right.
It's difficult for me to comment what exactly needs to be done, because, it's not enough information, but it's most of the people kind of react to babies okay. And if wife is there and she can protect him, so that should be okay. However, each case is highly individual, so it's difficult for me to comment. Is he on medications now?
Yeah, he's on, from what I understand, he's on like 2 or 3 medications.
Yeah. Unfortunately, the longer people stay on medications, the more difficult to ever get them off. And also, every case is, of course, individual. You mentioned that Ritalin or stimulant medications are the most commonly prescribed to young children. And unfortunately, they can, by themselves, cause all kind of issues later on. So it would be, for example, some people who take stimulants like Ritalin, Dexedrine, so they can later on develop a depression or bipolar disorder. So, and that can be something that can be so-called relapsing illness, meaning it can come over and over. So somebody who is taking care of them, if they're skillful how to deal with those issues, and if that person you're caring about is kind of disciplined, so it probably can be, medication may be able to be reduced, but it's usually a challenge.
Yeah. Okay. I hope I can get them. Oh, that's the other related question. Like, I'm sure it takes a while to educate a person how to taper down. Like, if you were working with a person who's been on medications for like 30 years of their life, you would probably need a long time to work with them, I'm guessing.
Yeah, absolutely. You cannot just say, look, let's cut tomorrow by half. In many cases, it depends on what medications somebody is taking. For example, some medications are available in liquid form. So then basically I would create a plan and explain to the patient how to very, very slowly decrease the liquid medication by let's say, by 1% every 10 days or so, or maybe even longer. And then observe how they react. Let's say I have one young lady in Florida. She has some mild mental retardations, and she has been on quite a few psychotropic medications. She is now taking Zyprexa, and for that medication there is no liquid form. So what we do, I'm giving her prescription for the through compounding pharmacy. We give it in a very small dose. Let's say the smallest dose of Zyprexa is at 2.5 milligrams. So she has this Zyprexa in different forms up to 0.01 milligram. Basically, when she is going down, it's through a very, very small dose. And she's very disciplined, and her mom is taking care of her. So she's doing, so far, food for food, she's doing well.
Well, that's good to know.
Right. So it's and then very important is to help people to develop awareness of what's going on with them, how they feel. Because that is the big issue that people need to be aware. Because unfortunately many people who are on medications, so medications sort of numb their feelings, emotions, and they don't feel anything. So teaching them how to become sensitive to yourself and to others, and how to feel what's happening with you is very important.
Wow.
Nowadays,
thank you.
Yeah, nowadays it's not that much in the ultra-Orthodox community, but in the regular community, there is an addiction to the electronic stuff, particularly to the phones. And there is this very interesting, very good book called The Anxious Generation. And it talks about how since the iPhones came to our life in 2012 or even earlier, basically the anxiety, depression, ADHD, all kind of psychotic and psychiatric conditions in the United States kind of just became wild, so many of them. So keep your community of those screen time. That is very helpful.
Yeah. Thank you, Chaya. Did you let me see if somebody else wanted. I'm going to unmute. Shulamit, did you have a question also? You wanted to share something?
Oh, thank you so much. This is really, really helpful to hear from you, Dr. Gurevich, and to hear the other questions that were being asked.
Thank you.
Yeah, it certainly resonates with my philosophy and definitely shows, Dr. Gurevich, your sensitivity and dedication to helping people the way that you spoke about what you do and your personal history. So thank you for having this. I'd love to hear the recording. I'd love to listen to it again at a later time.
Any question that you have? Anything I can answer?
Well, I recently had to end a marriage with somebody just because of, the pervasive issues that weren't really being addressed, and it was very hard. His family didn't really want him to get this help from you, and he himself wasn't willing to take the risk and just go for it. So, it's something that a loss that I've had to grieve. I'm still healing from. But it just, gives me hope to know that there's someone like you out there that wants to help people in this situation.
Right. It is understandable. Not everybody is ready to accept that they have an issue and it needs to be addressed. And there is a place for psychotropic medications as well, particularly when somebody in an acute condition. Supplements are not gonna cut it, not gonna be enough. So let's say I have a patient who I know now for probably, I know her for 25 years, and over the time, and she's somebody who has a so-called episodic psychotic disorder, meaning she functions well, she has 4 kids, she's doing well, but when there is a stress in her life, she cannot sleep, and within few days she can develop
come back a little later, but I'm showing, so.
psychosis, meaning she loses touch with reality. The first time I met her when she came to the emergency room, that was 25 plus years ago, and she was pacing and talking to herself. So she had to be hospitalized at that time, and she had to be treated with significant psychotropic medications. But then I was able to get her off, and I taught her that in case she develops kind of insomnia, in case she develops stress, even before she calls me, she should take the medications. She was not that willing to be on supplements, but she was okay to take the medications. And I hear from her now every maybe 2 to 3 years. I just had a call from her probably 2 weeks ago. She had some stressful issues with one of her children. She could not sleep. She was pacing, but she still had the medications from our last talk a couple of years ago. So she began to take them. She called me asking if they have expired. Of course, they have expired, so I sent her a new prescription. But by the time we talked, she was already in a better place. Many people have this condition where they don't need to be on medications all the time. It's just they need to learn kind of their limits of how much stress they can take. Okay, any other questions? Please.
Shulamit, I unmuted you. Do you have any other questions?
Just if you have any experience working with the populations that have been diagnosed with autism or this type, or different, varying degrees of special needs on the spectrum, regardless of whether they're verbal or nonverbal. Do you have any experience working with this population?
I do have an experience, but that's not what I like to do. I have a few patients who are in that category, but I cannot call myself a big expert at that. No, I'm sorry.
Okay.
I do have a few patients. I'm helping them. They're on a minimal amount of medications.
Sure.
It's not what I like to do.
Okay. Understood.
Okay, so let's go to the next one. Let me mute. Okay, this is, hold on one second. This one is FM. Somebody has the initials FM. Do you have a question?
No.
Okay.
Oh, I think I know who you are. Okay, I think I know your initials are. Do you have any questions for Dr. Gurevich? Not right now?
No,
okay.
Thank you.
Okay, no problem. Okay, I know who you are. All right, so she's muted again. All right, I have a question actually, Dr. Gurevich.
Sure.
So my brother has been on medication since he was started when he was in high school. They wanted to give him Zoloft, and he never really wanted to take any medication. He didn't want to be on pills. When he was about 17, my mom put him on disability, and he ended up being on disability, and then a few years later she had him hospitalized. So my question, and now he's 40, he's almost 41, he's turning 41. So my question for you is, he's been on risperidone for many years. That was the medication they decided to put him on with an injection. And they live in California, and there's actually a doctor in California that I think he does what you do. He's also like a holistic psychiatrist. I spoke to him. And he asked me what my brother's diagnosis was, and I wasn't sure. I thought it was maybe schizophrenia, but I don't know. And he said, well, if he's really schizophrenic, he needs medication. That's what he said. I said, but if he's not schizophrenic, there's a test you can do to see if he's actually schizophrenic. So that's what's one thing he said. And then I said, so do you taper people off medication? He said he does. But he would have to just see my brother. So my question to you is, he's been on risperidone. He's on the highest dose. What would you recommend based on him, if he was schizophrenic or not? Like, based on what he is, like, what would you do in my brother's situation and for his case?
So my question with patients like that, I'm trying to go through the history. And the most important thing, what happened? It sounds like since age of 17 he had some issues. And the question is, what kind of issues? For example, it's not that common in the Orthodox community, but in conventional community, quite often young people of that age start using different drugs. And I know that happens in Orthodox community as well. So that can be one of the issues. See, it's kind of, I don't know if there is any objective test to find if somebody has schizophrenia or not. As far as I know, there is no such test yet available. That's what I'm trying to say, that psychiatry is quite inaccurate discipline. Risperidone injectable is usually has quite significant side effect, particularly for men, because it is increasing some hormones which then men can develop, let's say, large breast and kind of have a more feminine look or gain weight. So the smaller dose you can maintain somebody on, the better. The question is, usually they put people on the injectable medications when they are not compliant with the oral medications. So psychiatrist, whoever is seeing him, probably should evaluate him in person. That's what I do. And then find out, is risperidone the best medication? Can it be done very slowly? Can medication be very slowly reduced or not? And there are multiple ways to test for that. But he needs to be, it's kind of, you need to discuss with the patient what's happening, why he's on medications. And then there is always it's always helpful to gradually decrease the medications. However, when somebody starts relapsing, then you know that you went too far. I always try to find out what are the abnormalities. For example, many of the patient needs to be on some supplementation, let's say vitamin B12 or folic acid. The number of supplements which can be given to supplement other minerals and vitamins which can be of help. If somebody cannot sleep, for example, so there are some sleeping aids, not medications. If somebody has anxiety, there are a number of non-prescription herbal supplements which can help with that. So there are many different options. Depending on the situation.
Okay, so to address what you said about the schizophrenia, the doctor said it's like he can measure his heartbeat, and that somehow is able to measure whether he's schizophrenic or not. And then I have a question if tardive dyskinesia can be reversed, and also my brother, he didn't develop any of those symptoms, but he paces a lot. He has, and then the dyskinesia, so he has akathisia, I think it's called. So he'll pace, and then
akinesia, right?
Yeah, and then and I think lately he has some movements, on his arm and it's a little on his, and then the other thing I was gonna say is he was on the injectable because, as I said, he didn't want to take oral medication, and he got hospitalized, and because of that they put him on the injectable. So
right.
That's what happened.
So most probably the doctor is talking about this procedure called heart rate variability. So it's basically every our heart does not beat like a metronome, but the pace of the heartbeat is constantly changing, and it can be assessed, and it's a good tool to assess for multiple conditions. However, that's not yet a definitive test for schizophrenia or not. As far as I know, I know about heart rate variability. I have the machine in my office. Unfortunately, we're not yet there to diagnose with this particular test. So tardive dyskinesia can be decreased or partially reversed. One of the best, if your brother really has a psychotic disorder, so one of the best medication for that is, unfortunately, is Clozaril. It's a medication that has been around for close to 35 years, and it's very effective. It can actually reduce the symptoms of tardive dyskinesia. So in that way, it can be of help. Some doctors are afraid to start patients on outpatient basis on this medication, but most of the time it's quite safe. I've been prescribing Clozaril for 30 years or so. I have a group of patients, small number. Some of them are with me for almost since I started my practice for 35 years. And they are doing exceptionally well. They are working, functioning. So they need to come to the office once a month and to have a blood test, and that's all. It's a pretty safe medication most of the time.
Okay, and so just one last question. We can wrap up soon. I just want to ask if my brother came to see you, you would look at his history, but also would you ever take him off the medication completely, or you would want to put him on something else?
No, it is usually a process. First of all, with your brother, if he lives in California, so I'm not going to be able to take somebody who is in California and treat on a distance. I'm not licensed in California. It's not going to be safe. What I do with patients like that is first I start, of course, evaluating what's happening with the patients. I did mention one of the things that I do is a muscle testing exam, kind of through this muscle testing exam, and it's something that I do is just an addition to the evaluation. I can find out if there are any significant issue, are there any infections, for example, any parasites, what organs are affected, and then basically initially I usually don't start titrating medications on the first visit, because first I need to be sure that somebody will be cooperative with what I'm trying to do, how I'm trying to help them. So we're developing understanding. Usually on the first visit I talk about, lifestyle changes, what needs to be done to improve the lifestyle, to start functioning better, sleeping better maybe at a normal time, exercise, diet, what diet needs to be done. If somebody is abusing marijuana or other stuff, how to help them to get off. So initially I just need to help people to to get back into more normal life. After I, patients, and the family sees that there is a change, there is an improvement, only then we can start lowering medications very slowly.
Okay, that's amazing. That's amazing. Thank you for that. That's really helpful for a lot of people. First, I have another question. How many patients so far have you helped? And then I have somebody who sent me a question. She said, how long of a wait is there to see you? And also, if you can spell the name of the medication that you had been prescribing for over 30 years, the one that is instead of the risperidone.
So the name of the medications, Clozaril, it's a well-known old antipsychotic medications. It has some potential side effects, so that's why people need to be kind of put in a special group, and they need to, for the first 6 months, have a blood test once a week, and then have a blood test every 2 weeks for the next 6 months, and then once a month. But most people tolerate it well. The medications doesn't need to be given in a big dose, and most of the people can, I help people to reduce their medication to the lowest level. Let's say I have now one very nice ultra-Orthodox man, so he has been on one of the highest dose of this Clozaril, 700 milligrams, which is a big dose. And actually on that dose he developed seizure. So he was given medications for seizures. So when he came to me, and I'm seeing him now probably over maybe 7-8 months or so, we're gradually reducing his clozaril. And because his seizures were caused by the clozaril itself, so I'm able to get him off his medication for seizures. He was on Tegretol. So he's doing well without that. He's functioning well. He's working. His older son is getting married now. He was my patient too for a short time. He's doing very well. Anyway, so medication called clozaril, Clozaril, clozaril. So I don't have a big waiting list. However, I don't take any insurances. So and I need to see, and I do see people who live in New York State or who can come to me in person, because prescriptions that I can write would be only in New York State. I'm licensed in New York State and not in other states.
Okay, thank you. Thank you for your help. I'm going to unmute everyone if they want to say something real fast here. Anyone else have anything else to say before we let him go?
Yeah, I want to know the one who just takes the antipsychotic short term. How need to take it?
There is some, yes. I'm sorry, can you repeat your question one more time?
Yeah, the one who just takes the antipsychotics short term when she gets stressed. How long does she take the antipsychotics for?
Oh, she takes it maybe for a week or 2 weeks, and then I teach her. I already taught her over the years how to go down. So she gradually reduces her dose, and she gets off, and I don't hear from her for a couple of years, and or whatever time, and then she's doing quite well. She retired now, and so years ago she had issues with her husband, who actually committed suicide. One of her sons has also significant psychiatric issues. So she had some stress in her life, which is a very legitimate one. And so, but she learned how to deal with that and how to recognize that the storm is coming and what needs to be done. So, and that's very helpful.
That's great. Thank you. I like how you focus on emotional healing as well. As a doctor, that's very helpful. So, anyways, this is Dr. Gurevich. We're trying to raise money to get more people to come to you. So it's not so easy, but that's one of the things we're doing. So thank you so much for coming on. I think that's it. Maybe, I can unmute if anybody else has anything else to say.
So it was a pleasure to talk to you, and I'm glad to serve the community, help as much as I can.
Thank you so much. You're fascinating.
Okay. Have a good day.
God bless you.
Okay. God bless you. Very good. Take care. Bye-bye.
Take care. Bye-bye. Thank you, Dr. Gurevich. Have a good day. Thank you.
Wow, Ronit, that was special. Wow. Thank you, Ronit.
Hey, you're welcome. You're welcome. You got something out of it. Okay, good. Okay. Shul, are you there? I hear you a little bit. Okay. All right, guys. Hopefully you're able to get something out of it. Shul, are you there?
How do we get the recording?
You want the recording?
Yeah.
Okay, I did record it, so I'm gonna after I get off the call, I'm gonna look at it and see. I might have to edit a little bit, and then I can send it to you. Okay?
Okay, I just want to hear like the beginning part, basically. I don't need the questions. Oh.
Yeah, of course. Yeah, for sure.
So, but I just want the beginning.
Okay, maybe I'll edit it so it's just the beginning. Well, it's anonymous anyway because we didn't really say our names.
Right.
But
yeah, the whole thing would be good then.
Yeah. Okay. Okay.
I don't want to hear the whole thing. Okay.
Okay.
Okay. Thank you.
You're welcome. Enjoy the rest of your day.
You too. Bye.
Okay. Take care.
Bye.
All the best. All the best.
I don't know that
I'm going to leave the meeting, guys, so feel free to leave whenever you feel.